Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 117. A 52-year-old man for the last 3 years has been suffering from difficult swallowing of solid food. Burning retrosternal pain that aggravated during eating, loss of body mass, and occasional vomiting. With undigested food. Esophageal X-ray shows S-shaped deformation of the esophagus and its dilation. At the cardiac orifice, the esophagus is constricted. Esophageal mucosa is smooth, without signs of peristalsis. Make the provisional diagnosis. A. Diaphragmatic hernia. B. Esophageal diverticulum. C. Reflux esophagitis. D. Esophageal achalasia. E. Esophageal carcinoma. Achalasia is a disorder in which damaged nerves in the esophagus prevent it from working as it should. The lower esophageal sphincter fails to allow food to enter the stomach. Symptoms include trouble swallowing, heartburn, and chest pain. It contains a risk factor for the development of cancer, especially in megaesophagus. Chronic irritation of foods and bacterial overgrowth may contribute to the formation of high-grade dysplasia and squamous cell carcinoma. In other cases, achalasia is caused by a tumor. Achalasia may be clinically indistinguishable from esophageal cancer. Patients present with a long history of regurgitation and slowly progressive dysphagia. Upper gastrointestinal imaging or barium study shows a typical bird's beak filling defect. Esophageal cancer results when abnormal cells grow out of control in esophageal tissue. Types. Squamous cell carcinoma begins in the squamous cells that line the esophagus. It usually affects the upper and middle part of the esophagus. Adenocarcinoma develops in the tissue that produces mucus that aids in swallowing. It generally occurs in the lower part of the esophagus. The answer is E. Esophageal carcinoma.